Greetings everyone. Today I Jasmine Kaur studying MBBS second semester is going to explain the topics the intercostal spaces and intercostal muscles, which are important topics related to the anatomy of thorax. These topics were explained to us by our professor Dr. Kuldeep Kumar sir. So let's begin with the topic intercostal spaces. The intercostal spaces are the spaces present between the two adjacent ribs. There are total 11 intercostal spaces, whereas only first 6 intercostal spaces are related to the sternum. These structures related to the intercostal spaces, or we can say the content of the intercostal spaces, are the intercostal muscles, nerves, veins, and arteries. The three of them, the intercostal arteries, the intercostal veins, and intercostal nerves, are together form the neurovascular bundle of the thoracic wall. Now we will talk about the intercostal muscles. The intercostal muscles are three intercostal muscles: the external intercostal muscle, the internal intercostal muscle, and innermost intercostal muscle. The innermost intercostal muscle is further made up of three types: the subcostalis, the intercostalis intimani, and the sternocostalis. The sternocostalis is also known as the transverse costalis. The arrangement of these muscles. The arrangement of these muscles is like the external intercostal muscle arises posteriorly and attaches to the sternum as the interior or the external intercostal membrane, whereas internal intercostal muscle arises from the sternum and attaches posteriorly as the posterior or the internal intercostal membrane, whereas the innermost intercostal muscle made up of three parts: the subcostalis, sternocostalis, and the intercostalis intimani has no membranous attachment. Now we will talk about the neurovascular plane. The neurovascular plane is present between the two muscles, the internal costalis muscle and the innermost intercostalis muscles. Okay, so in this there is arrangement of structures. Vein, which means the vein, intercostal vein comes first, then arteries, then nerve, whereas there is an exception in which first intercostal spaces the structures are arranged in the order nav, which means intercostalis nerves come first, then arteries, and then veins. The clinical significance of these are it is used for the intercostal nerve blockage. It means the anesthetic administered at the lower border of the upper rib, because these neurovascular bundles are arranged at the lower border of our upper rib, whereas the pleural tape effusion is done at the upper border of the lower rib to avoid the neurovascular bundles damage, or we can say to avoid the damage of the intercostal nerve. Now we will talk about the arrangement of the nerves. Okay, in the nerves, the intercostal nerve arises from the spinal cord, travels interiorly, and gives branch the lateral cutaneous branch, which pursues two muscles, the internal intercostal muscle and external intercostal muscles, which gives two division, the posterior division and an interior division, which further the intercostal nerve further travels interiorly and give interior cutaneous branch, which gives two divisions, the medial division and a lateral division. The interior cutaneous branch pursues one muscle and a one membrane. The muscle it pursues is the internal intercostal muscle, whereas membrane it pursues is the external intercostal membrane, and gives two divisions, the medial division and lateral division. Medial division synapses with the medial division of the another interior intercutaneous nerve, whereas the lateral division synapses with the interior division of the lateral cutaneous nerve. The intercostal nerves are of two types: the typical intercostal nerve and the atypical intercostal nerves. Typical intercostal nerve supplies the supplies the intercostal space and thoracic wall. These nerves are T3, T4, T5 and T6, whereas atypical intercostal supplies beyond the intercostal spaces and a thoracic wall. These are T1 that supplies the brachial plexus, T2 in which the lateral cutaneous branch joins the medial cutaneous branch of an arm and forms the enterocostobrachial nerve, whereas T7 and a T11 from T7 to T11 T11, these enter rectus sheath and supplies the abdominal muscles and form the thoraco-abdominal nerve, and T12, which is not an intercostal nerve but a subcostal nerve. So these were their topics: intercostal space and intercostal muscles. Thank you so much for your attentions, and thank you so much, sir, for giving me this chance.